So what's a vulva? The vulva is the external female genitalia. So not to be confused with the vagina, which is the inside. Vulva is the skin only on the outside, but it's a large area of skin. And it ranges from right at the top of the mons pubis, which is where the pubic hairline starts, all the way down towards the anus. So it incorporates the clitoral hood and clitoris, the urethra, which is from where we wee, the vaginal entrance, but nothing within or deeper than the vaginal entrance, and the skin between the vaginal entrance and the anus, which is the perineum. And then laterally, the skin that extends to the groin crease, which is the labia majora. So a large area of skin which can, just like any other part of our skin, become inflamed, irritated, and give us symptoms. And nobody really ever teaches us how to look after our vulvas. So a couple of do's. Do look at your vulva. So just as you would do a breast examination regularly, perhaps every month, do the same for the vulva. Get to know what it looks like so that you can identify any changes. Bit trickier to examine the vulva, so you do need a good mirror and a good source of light. Secondly, hydrate the skin. Look after the skin, because this skin is subject to lots of walking, sitting, wearing underwear, wearing tight clothes, all of which is quite abrasive to the skin. So applying a moisturiser to soothe, protect, hydrate the skin, and also a barrier to all of those external pressures is a really good idea. So putting it on in the morning, perhaps again at bedtime, will just boost the general quality of the skin. And then the don'ts. Avoid all the potential irritants, particularly the perfumed products. So don't put anything directly on the skin that is perfumed or soapy in nature. And really avoid the feminine wipes, hygiene products, deodorants, because they have chemicals in that disrupt the natural microbiome of our skin. The other thing is, don't overwash. Washing once a day is absolutely plenty. Again, overwashing disturbs that nice natural balance of good bacteria. And allow the vulval skin to aerate. So don't go to bed with underwear on. Night shirts are better than pyjamas. It just allows the vulval skin to breathe. So what's a vulval clinic? If you have any symptoms on the vulva, then you can be referred to a vulval clinic for a specialist in this particular area. And the things we tend to see a lot of are skin inflammatory conditions, so things like lichen sclerosis, lichen planus, lichen simplex, but also eczema, psoriasis, so any sort of inflammatory skin process on that part of the body. Lumps and bumps, because of the nature of the skin on the vulva, it's very glandular, so it's prone to developing lumps and bumps, cystic lesions. The vast majority of those are benign in nature, but there's always a chance that some lesions could be precancerous or cancerous. Vulval pain syndromes, of which vulvodynia is the big one, so that's a nerve pain disorder and causes a lot of discomfort. And infections, so something like thrush we see on the vulva is much more resistant to normal treatments than perhaps the more common version of thrush that we see in the vagina. So, take-home messages. Do get to know your own vulva by self-examination. Simple measures to look after your vulva. And if you have any concerns, see a specialist.